Hi everyone! Welcome to another episode of Raffles Podcast, a series brought to you by Raffles Medical Group. My name is Clinton. In today's episode, we will be exploring the topic of insomnia with Dr. Anita. She will share with us the common causes of insomnia and how we can cultivate a healthy sleep cycle to say goodbye to the condition. Thanks for joining us, Dr. Anita.
Hi Clinton, thank you for having me on board.
Dr. Anita, I suppose sleeping difficulty may not be an uncommon complaint that family physicians like yourself see. Is this true?
That's right, Clinton. Insomnia is not an uncommon health problem, as you have rightly pointed out. In fact, studies have shown that 30 to 40% of adults indicate some level of insomnia within any given year, and about 10 to 15% indicate that the insomnia is chronic, severe, or both. The prevalence of insomnia increases with age and is more common in women.
Wow! I never knew that it affects women more than men. So, Dr. Anita, we often say that we have insomnia whenever we cannot sleep at night. Is this the right definition? What's the science behind it?
Insomnia is defined as not having enough sleep that is sufficiently long or good enough to feel well rested. Insomnia can be divided as being acute or chronic. Acute insomnia could be lasting just a few weeks, and chronic insomnia is when sleep difficulties happen for at least 3 nights of the week for 3 months or more. There could be difficulties with different stages in the sleep cycle, namely difficulty to initiate sleep, maintaining sleep, early morning wakening with difficulty to fall back to sleep again, or even intermittent wakening. It could also be a combination of this.
I see. I understand better now. But what about the causes? How do people actually get insomnia?
So the causes of insomnia can be classified as being primary or secondary. Primary insomnia means that there is no other health problem linked to or causing the sleeping issue. Secondary insomnia means that there is an underlying health condition causing the sleeping issue. For example, this can be due to certain medications, which can have a high stimulant effect. This includes things like caffeine intake, tobacco found in cigarette smoke, nicotine, and alcohol intake. It can also be due to urinary issues, which causes one to wake up at night repeatedly. This can occur in conditions such as diabetes. It can also be due to certain psychiatric conditions that contribute to the insomnia, such as depression or anxiety. Disorders of breathing, such as obstructive sleep apnea, can also cause insomnia. Of course, there are also environmental factors that can cause insomnia, such as a noisy or unpleasant sleeping environment. Frequent heavy meals before sleep or gastric reflux can also affect the sleep-wake cycle and result in poor sleep quality.
Wow! So there are many factors that may actually lead to the condition. What are some of the health implications of insomnia?
Insomnia can result in poor concentration and daytime sleepiness. It can also result in low quality of life and missing work regularly because of lack of rest and fatigue. This can also result in frequent MC taking. Sleepiness during your waking hours can also make you an unsafe driver, where accidents can happen both during the day and night due to a lack of rest.
I see. I do have a question from what you shared. What does a normal sleep cycle look like?
So circadian rhythms are 24-hour cycles that are part of our body's internal clock, which helps us to regulate our day-to-day functions. One of the most important circadian rhythms is none other than the sleep-wake cycle. Our circadian rhythm helps align our sleep and determine how awake we are throughout the day. Frequent interruptions to this cycle can cause insomnia.
Dr. Anita, what do you mean by interruptions?
This includes spending too much time in bed, variable sleep and waking times, including going to bed much later on weekends, for example, prolonged daytime sleeping, excessive alcohol or caffeine consumption, and smoking. Some patients also rely on drowsy medications or alcohol to help them sleep. This includes the use of sleeping tablets or other drowsy medications. These medications can also affect their sleep-wake cycle and worsen insomnia. Engaging in stimulating activities before sleep can also affect getting to sleep. Patients who engage in regular shift activity may also face disruptions to their sleep-wake cycle that can cause insomnia.
You mentioned about lifestyle factors that can contribute to insomnia. What can we do to avoid insomnia?
So some of the day-to-day changes we can make to avoid insomnia include the following, such as avoiding frequent daytime naps. It also includes getting to bed the same time daily. Avoid falling asleep in front of the TV, as this can affect your sleep quality. Avoid excessive caffeine intake before bedtime. Taking large amounts of alcohol and caffeine can also increase the urge to urinate at night. Avoid vigorous activity or stressful thoughts close to bedtime. Taking heavy meals can also cause reflux and affect sleep quality at night. Ensure a conducive sleep environment. This includes reducing noise in the environment and ensuring that the room is dark with no excessive lighting. Also avoid excessive time in bed for activities other than sleep.
So if someone does all this and they still have trouble sleeping, what can they do?
It is important to see a doctor if you suspect you have insomnia or the day-to-day lifestyle changes are not working. In addition to the lifestyle modifications we spoke about, addressing poor sleep and treating this will also improve the quality of your life. Maintaining a healthy diet and incorporating regular exercise into your lifestyle will also help improve your sleep cycle and sleep quality.
Thank you for sharing these insights, Dr. Anita. I definitely understand more about insomnia now. Thank you for your time today. To our listeners, we hope that you found this episode useful. If you would like to find out more about Raffles Medical Group, please visit our website at www.rafflesmedicalgroup.com or follow us on our social media channels. In the meantime, be well and stay positive. My name is Clinton, and I look forward to meeting you in our next episode of Raffles Podcast.